Most people can attest to having a back pain incident at least once in their lifetime. It may be from a fall or a heavy lifting, but usually goes away over time. Tying your shoelaces may not seem like a privilege now, but what if the next backache you get is a lumbar spondylosis? Can you get away from it? I'm your host, Bill Hawaka, and welcome to the program. On today's episode of Health and Flavor, we shall discuss lumbar spondylosis, otherwise known as lumbago. Here is what is ahead on the program.
You take your knees up, so we start like this. Opposite knee, opposite leg.
Lumbar spondylosis are degenerative changes that occur in the spine, commonly referred to as osteoarthritis by a lot of patients.
Yeah, it's actually very common. Yeah, that people actually get this condition, especially during old age.
Yeah.
And in simple terms, I could actually call it, spinal arthritis.
Lumbar spondylosis refers to degenerative changes that occur on the lower part of the spine. We walked in the streets of Nairobi just to find out what people think or know about lower back pain.
Lumbar spondylosis. I don't know how to pronounce it very well, but I heard someone say it comes from chemicals in industries.
I have never heard that. Never.
You've never had a disease called lumbar spondylosis?
I'm just hearing it now. Never.
Okay.
No.
Never?
No.
In the whole of your lifetime, you've not had lumbar spondylosis?
No.
Treatment efforts to control pain and swelling, minimize disability, and improve the quality of life with lumbar spondylosis often require medical interventions. Let's find out more from Dr. Tom Boyer.
Lumbar spondylosis are degenerative changes that occur in the spine, commonly referred to as osteoarthritis by a lot of patients. The lumbar is the lower back. Most people, when they come to the hospital, they complain of lower back pain, but it can also occur in the neck, and that is called cervical spondylosis. That is the neck region, or it can occur also on the upper part of the back of the thorax. We call that thoracic spondylosis. The commonest signs and symptoms of lumbar spondylosis eventually manifest themselves as pain. But then about 20 to 40% of the patients with lumbar spondylosis would not start by seeing pain manifesting as one of the symptoms initially. So depending on where it affects, if it brings about a pinching of the nerves, presents with pain, but if the nerve is affected fully, can present with weaknesses of the lower limbs. Then you feel pins and needles of the lower limbs, so of the legs and the toes. And apart from pins and needles, patients may also present with weakness and muscle spasms. Muscle spasms are when the muscles contract but do not release up from the contraction. So they're in almost like a permanent state of being contracted. Patients present with pain commonly with the spasms. So age is the primary predisposing factor to developing lumbar spondylosis. And apart from age, we have genetics. That's to say, if in the family tree, your parents or your siblings older than yourself have already developed lumbar spondylosis, then chances are you will also have lumbar spondylosis. And then injury to the backbone. It can be sports related while playing contact sports like football, you fall down, or rugby, someone hits you from the back. Or it can be an injury from a fall when you're a baby playing and you don't even notice. It can happen when you're much younger. Or injuries from road traffic accidents that eventually are treated and then you feel like you've healed, but then the subsequent manifestation of these healed parts of the bones is that eventually they develop spondylosis. So first in our list of management of lumbar spondylosis is medication. And that includes the non-steroidal anti-inflammatory medications which patients swallow, and also the analgesics, which are primarily painkillers. Apart from that, we have more severe and intense definitive management. So if the degeneration, which we call spondylosis in this case, has resulted to some bones either having an overgrowth or maybe bones not being in the right pocket where the nerves pass through, then the bones can be corrected, they can be shifted back into position. And that involves surgery. So apart from medication and surgery, we have things that the patient can do themselves, and one of them is called self-care. There are those who, as a result of walking or standing for too long, they feel the pain, so they want to lie down. That is going to form a major part of the self-care. Apart from self-care, we have now more professional things to do. These can involve the use of physiotherapists to support your management and pain management and the development away from the severe form of the disease. The commonest side effects to management would come as a result of treatment. The first one being medicine. Some people are allergic to the non-steroidal anti-inflammatory drugs, so they have gastric irritation. With the surgery, there are some side effects, and the kind of anesthesia used can bring problems to certain types of patients. So these are things that you discuss with the anesthetist before you go in for surgery. If you're allergic to any medications, then these are some of the things that are also discussed with the health providers before you go in for any surgery. There are particular dietary and fitness considerations for patients with lumbar spondylosis. Lumbar spondylosis, being a degenerative change, occurs more so in the elderly people. And so if there's a degenerative change in the lower part of the back, and for instance, someone is overweight, we want them to try and lose that weight, because the more the weight in the upper part of the body, the more the stress on the lower part of the backbone where the problem is. So loss of body weight, for those who are morbidly obese, that's to say their weight interferes with their day-to-day functions. Apart from that, calcium supplements in their diet, it can be in the form of medication or it can be in the form of food that they eat. So they should eat food that is more rich in calcium. Be careful not to overdose and have very high calcium levels in your blood, because again, that's a problem. Apart from calcium levels, generally eating of a balanced diet is a very, very good thing. Working out is a very good thing, doing sit-ups and doing exercises that support the back. But these exercises for patients with lumbar spondylosis have got to be guided. So they'll definitely need the input either of a neurologist. If the pain is too much, they may need the input of a neurologist before they go for physiotherapy. But then even when they're doing physiotherapy, the marker is you should be improving. You should not be getting worse. So if you're doing physiotherapy and the pain is becoming worse, then there could be a problem. Maybe it could be worsening. So you need to come back to a neurologist to see you to diagnose whether you can continue. But then we also have nerve conduction studies that are being done on the nerves to see if there are any problems. In conclusion, lumbar spondylosis is, like we said, a degenerative disorder, which means it occurs with age, commonly in elderly people. However, even with x-rays done in younger patients, patients who are asymptomatic, which is to mean they don't have any symptoms, they're not in pain, they're just normal, such patients still are showing signs of spondylosis in their x-rays. That's to say, a big percentage of human beings, or about 50%, or slightly over 50%, may develop lumbar spondylosis. And so to the viewers, this is to encourage you to attend to those with lumbar spondylosis, seek medical attention as soon as you're developing lower back pain. When it is caught early enough, we are able to manage and the quality of life is improved.
When asked to see a nutritionist for lumbar spondylosis, it can make one curious if there's any nutrition intervention that can actually diminish a back pain or even treat it. Well, you will be enlightened with the great insight that our nutrition expert Kefa Nyandumba gave us. Hello viewers, welcome to Health and Flavors Nutrition segment. lower back pain, muscle spasm, weakness of affected limbs. These are just some of the few and consistent pains that come with lumbar spondylosis. And for this, we are looking at the dietary changes that a patient with this disease can make so that they can be able to improve their health. We have Mr. Kefa Nyanumba on set, and he's going to take us through the dietary changes and the overview nutrition for this kind of disease. Hello, how are you?
Fine, thank you.
Thank you so much for making time to be with us.
Thank you so much.
So tell us, lumbar spondylosis, pain, back pain, right?
Yeah, it's actually very common.
Yeah.
Yeah, that people actually get this condition, especially during old age.
Yeah.
And in simple terms, I could actually call it, spinal arthritis.
Oh, okay.
So that our audience can actually be able to understand it.
Yeah, the name is usually quite long. Lumbar spondylosis, yeah.
Let's call it spinal arthritis.
Okay.
Yeah, and of course, as you said, many people talk of lower back pain, muscle spasms. And for these conditions to improve, of course, we need to make sure that we make nutrition intervention as one of the key components when it comes to the management of this condition.
All right. Yes. So like for this case study, we're looking at a 56-year-old male, Mr. Justin. That's not our patient's real name. And Mr. Justin was, we look at his history, diet history. He takes a lot of black coffee. Yeah. And he avoids taking dairy products and milk. Yes. Yeah.
Now, for patients with this condition, calcium is very important. And we can actually get calcium from dairy products, for example. Like milk is actually very good for that. We know we have yogurt and so many other sources like seafoods, of course. But for him, I think it's not taking milk because of issues to do with lactose intolerance. So, but he can actually be able to get calcium from other sources. Okay. Yeah.
What are the sources, for instance?
For example, I've talked of seafoods like sardines. They're very good for that, for calcium. And they also have vitamin D, which is also a very important nutrient that assists in the absorption of calcium. Because we cannot talk about calcium without talking about vitamin D. We can actually get it from the sun.
Okay. Yes. Oh, so speaking of that, so how about those people who... let's say in areas where there's not too much sunlight.
Okay, we can also get it from some of the foods. For example, we have mushrooms. They're very good. You can in terms of vitamin D. Egg yolks can also assist us to get vitamin D. And of course, the other people who usually go for injections, but we recommend that we get most of our nutrients from the foods, or in the case of vitamin D, from the sun. Okay. Yes.
All right, and then I see that Justin takes a lot of his daily meal consists of roasted meat and occasionally takes some beers.
Okay, now talking about red meat, it's actually not very good when it comes to the management of spinal arthritis because it leads to overproduction of uric acid, which is actually one of the products of protein breakdown. So it needs to get rid of the roasted meat. Instead, it can make use of the other proteins like the legumes. For example, we have beans that are actually very good sources of plant protein. We have mushrooms that are also classified under proteins. We have eggs. So those are some of the other proteins that you can actually make use of so that you can be able to get rid of the red meat because of the uric acid.
All right. Yes. Then we see that he does not like taking fruits and water.
Yeah, water is very important. But before I talk about water, it's important for me to talk about coffee. That coffee actually dehydrates the body. So it's very important that he actually tries to avoid black coffee. Yeah, and coffee is also not very good when it comes to calcium absorption. So he needs to get rid of the coffee. Okay. Yeah, so it needs to increase water, of course, after that. And of course, we recommend at least 2 liters of water per day. All right. That is on the lower side. Okay. Yes.
And how about these fruits that he does not like taking?
Now, fruits are very important for everybody. Of course, they're supposed to form part of our diet. Yeah. For example, in front of us, we have, for example, the passion fruits that are very good sources of vitamin C. Oh. Vitamin C is one of the antioxidants that assist to get rid of free radicals. And free radicals usually tend to promote what you call inflammation. So I would actually recommend that he try to introduce fruits as part of his diet. He could actually, if you can be able to take at least 2 types of fruits per day, it's going to be good. Yes.
I see that Justin does some exercises. He says that he tries to keep fit and he does some exercise. At least 5 days a week, he does some vigorous exercise. Yes.
Yeah. Now, exercise is important, of course, to everybody. But when we're talking of this condition, we recommend simple forms of exercise, moderate forms of exercise. Because we also skin to make sure that you don't interfere with the joints.
Okay.
Yeah, so simple forms of exercise are going to be very good, like walking can be very good. So, but they're supposed to be moderate. But exercise is very important because, again, we want to make sure that we address issues to do with excessive weight gain. For example, if for the people of back pain and knee pain, one of the challenges they get when the weight increases is the fact that such conditions usually become worse. So that is why exercise is very important, but it has to be moderate. And that's why guidance needs to come in. It needs to work with, for example, a fitness trainer who understands this condition.
Okay.
Yeah.
Okay.
Yeah.
And then you've also said that this person altogether to cut down on roasted.
Yes, roasted meat, I could not encourage that because of the uric acid. And of course, for people who take roasted meat and alcohol, that's a very bad combination.
Okay.
That's a very bad combination, especially for people with this condition.
All right.
Yeah, that's very bad.
It's like what I've had you say one time,
Yeah,
for like
yeah,
adding gas with petroleum with fire.
Yes, it's like petrol and fire, actually. That's a very bad combination.
Yeah.
Yes. Maybe before I forget, it's also important that he tries to include food sources of omega-3, because omega-3 usually tends to reduce inflammation. The examples include the flax seeds and the chia seeds, etc., and plus the seafoods as well.
All right.
Yes.
Okay.
Yeah.
Wow. I had so many questions to ask, but unfortunately, we've reached the end of this segment. Thank you so much for having us in your living rooms. Up until next time from us. Cheers. You may be able to steer clear of back pain or prevent its recurrence by improving your physical activities and practicing proper body mechanics. Exercise is deemed to be vital for everyone, but with lumbar spondylosis, you can never know what is too much or too little. Our fitness expert, Mr. Nzuki, gave us some tip-offs on how to go about it. Hello, everyone. Welcome to Health and Flavor. On this fitness segment, we are looking at exercises that are suitable for patients with lumbar spondylosis. In other words, back pain. And on set, we have Mr. Nzuki. He's our fitness expert. Hello, how are you?
I'm fine, Bella.
All right. So then where do we start, Mr. Nzuki?
So, yes, it's an exercise for the back. So we don't expect to be standing. We expect to be on our mat, lying down, right?
All right.
For this exercise,
Yes.
it's supposed that you do it on a carpet like this with the exercise mat, or on a table with a mat, but not on a bed.
Okay.
Yeah. So for you to feel it, or for you to get what I'm saying, I would like you to put your hand here.
All right. On your lower back.
Yes. A little crunch. You see, I'm pressing my pelvic down.
All right.
The most important thing is to press the pelvic down. Don't come too high. No, it's for the better of the pelvis. You press, yeah. So we press it down when you do that little crunch. I can see I can feel the pelvic. You take your knees up. So we start like this. Opposite knee, opposite leg. Just slowly. If the legs are quite heavy, because there are people who have weight, they are not as light as me. They can do one leg at a time, but slowly. The most important thing is to press the pelvic down. Press the pelvic down. This person now is getting better from day to day.
Yes.
Now we need to upgrade. They are becoming active. They can walk. They can do something. So now we can get the ball to help us in the same exercise to increase the intensity. After that, your abs, You lie on your ball. And then I'm just demonstrating. You look for the balance. Take care of yourself. The ball might roll and leave you. So safety. Make sure you are safe. Okay. Now the remaining part is where we have to stretch the lower back.
We lay flat, huh?
Yes. Facing up. Cross your legs there. It's called hug yourself. Hug yourself. So as you hug yourself, try to come up slightly. Down. Press the pelvic down. This is the pelvic. Press it down. And you also have someone who could be having issues with the knees.
Yes.
If you have pain in your knees, you can hold here. You can hug yourself like this. Is there? You come up, down. You hold up there. Then you go down. The last stretch,
Yes.
we have to strengthen the hamstring. You place it down here, not at the toes and not at the base, at the heel. So it's right.
The middle of the toe.
Yes, middle of the toe. Then take the leg up. You feel the hamstring stretching, and also as you do it, your pelvic is being pressed down here.
The exercises that cannot be done by people with lower back pain.
Yeah.
All right.
Most of them, they are the extension exercises.
Extension exercise.
Yes, like the cobra stretch. Okay, this one can be a good exercise for people with back problem, but not for lumbar spondylosis.
All right.
Yeah, whereby you hug your back. It's called a cobra stretch. In most cases, it's not the best. He's not a good one for
So a cobra stretch is good for back pain, all right, but not for lower back pain.
So the other exercises you should avoid. They are exercises which makes you lean, like coming up, washing the ceiling, you clean the ceiling, or doing your works which makes you lean back, or even doing this type of exercise. That's not very good for a person.
So generally exercises that make you lean back, curve your back are dangerous are not advisable.
Yes, they're not
Advisable.
more suitable. Yeah.
Okay, they're not suitable for people who have the lower back pain or just, to be specific, lumbar spondylosis. Yes. Thank you so much for that tip. I'm so sure viewers at home have enjoyed that and have learned a lot from that. All right, so then for our viewers back at home, we've reached the end of this fitness segment. I hope that you have learned 1 or 2, 3 tips that you can be able to use at home. Remember, an ounce of prevention is better than a pound of treatment.
Hi, my name is Dr. Fasaz Agai, a general surgeon and a public health specialist. Let me take a brief moment to review today's topic on lumbar spondylosis. Lumbar spondylosis is a degenerative disorder affecting the lumbar region of the lower back. It is a condition involving changes to the bones, disc, and joints of the lower part of the back. These changes are caused by the normal wear and tear of aging. Spondylosis is a degenerative process, but some measures may be helpful to prevent the neck and the back pain that spondylosis may cause. Number 1, work with your doctor to develop a safe workout plan for you. Try to incorporate resistance training, aerobics, and flexibility exercise into your routine. Number 2, being overweight or obese puts additional stress on pressure on the joints in your spine. This can cause the normal wear and tear process to move fast. Number 3, eat healthy, balanced food based on fruits, vegetables, whole grains, low-fat dairy products, and lean meat protein. Number 4, take breaks throughout the day, especially if you work at a desk all day. Getting up to stretch every 30 minutes gives your back a chance to recover from the strain of sitting for hours. Number 5, develop a healthy sitting and standing posture so as to promote good back health. Number 6, learn how to lift weight properly so you can avoid excessive strain on your back. Number 7, stop smoking and avoid use of alcohol. Smoking accelerates the aging process, and too much alcohol can lead to dehydration, which is bad for your spine. There is no sure way to tell if you will completely avoid developing spondylosis. But leading a healthy lifestyle is one of the best ways to prevent lumbar spondylosis.
We have seen the diagnostic and therapeutic approaches of lumbago, the exercises that we can do, and the link between nutrition and back pain. I, for sure, am willing and ready to do what is best for my spine. No more lean backs. Will Rogers, an actor from the 20th century, once remarked, "Pain is such an uncomfortable feeling that even a tiny amount of it is enough to ruin every enjoyment." This has been Health and Flavor, and I have been your host, Bill Hawaka. Until next time, adios.